back at Indiana Physical Therapy, and I am talking with Terra. We're going to talk about lymphedema today. Terra, I can honestly say I don't know what lymphedema is, so I'm probably not in the minority. Tell viewers what lymphedema is and how coming to IPT can potentially help us.
Okay. Well, lymphedema is basically dealing with your lymphatic system, and it basically is the way that your body gets rid of all the cell debris, bacteria, potential infections, basically any of the junk and the crud that's left in your skin and in your tissues, and your body's way of getting rid of it. And lymphedema basically develops when there's a problem with how that fluid gets out.
Okay.
And the more that it gets plugged up, the more it backs up into like an arm or a leg or potentially into the trunk, and then it can start to cause problems.
So when we hear about the lymph nodes, that's what we're talking about?
That's part of it.
Okay.
That's part of it. The lymphedema basically develops when there's a problem where the lymph nodes have either been removed or there's a damage to them, or for whatever reason the system just it's not keeping up. It's not being as efficient and as effective as it needs to.
Okay.
And in that happening, then you start to see that the tissues start to thicken up. It's basically kind of like a traffic jam. If it can't get through in one place, it starts backing up until you start to see it develop into more swelling into the limb and into the area, causing more problems.
Okay, so that's what happens when the lymphedema is untreated?
To a degree, yes, it can. In a lot of those instances, when it's untreated, you can increase the risk of an infection. You can increase the risk of losing the use or the mobility in that limb, getting a lot of the scar tissue and things developing, and it can just cause a lot of other, potential problems down the road, the skin integrity, things that way. But the biggest thing with it is that it's the damage that happens to the tissues over a long period of time.
So how do we know when this is happening? What are the signs and symptoms of lymphedema? When do we know when it's time to contact the physician and then come see you at IPT?
Basically, the biggest thing would be is anytime that you're having swelling or any kind of problems like that, definitely go see your physician, because there's some other things that it could potentially be that need to be ruled out, and make sure that you're good to go to be able to come in and have us do the treatment and do the assessments and things that way. But once that's done, then some of the other symptoms a lot of times that patients come in with is they have a history of having had the lymph nodes either removed or having some kind of a damage or injury that way, a node dissection with surgeries where they've had to take those tissues out. A lot of times the tightness and the stiffness in the arm, or the leg, they just lose the mobility, it just doesn't feel quite right. The fact that the arm feels heavy. They don't complain so much of pain all the time. They'll say it aches, it's heavy, it's sore, I just can't move it around, feels kind of like it's dead weight all the time. Or they'll come in and say, you know what, my ring is really tight, or my watch band is tight, my socks leave marks on my legs, but clothing, they'll start to notice the difference more cosmetically that way because the clothing just doesn't fit quite right.
Right. Okay, so if we've had this diagnosis, we know that it is lymphedema. What can we expect from treatment? What is going to happen when we do come into IPT?
Well, treatment for lymphedema is a little bit different than what you think of when you think of physical therapy. There is an exercise component to it, but it's a little different than what you see when you have somebody on a treatment table and things like that out here. The kind of gold standard that we use is called comprehensive decongestive therapy, and it's kind of a multi-phase approach where there's some hands-on techniques like a manual lymph drainage, which is almost kind of like a massage type technique to get that fluid moving and getting it going in the right direction that we want it to. There's a lot of patient education to them to understand how they can help to manage this and keep it going at home when they're done with us, to help it keep it under control. There's components with compression, different types of compression at different points in time in the therapy as it's needed, as well as skin integrity and infection control type issues if those things are needed. So again, it's more getting the patient in, getting a good history of what's going on with them, and seeing what all they need to do, and getting them in here specifically to the Stellhorn Clinic, because this is where that is basically based out of. Myself and Ruthie are the two therapists that do a lot of the lymphedema therapy here. So they would basically be coming here to see us and then getting them set up with an individualized plan themselves.
Fantastic. Well, if these are some symptoms that it sounds like are familiar to you or someone you love, be sure that you go to your physician, get a referral, and come on into IPT today. You can give them a call or check them out on the web, and we will be right back on Insight.